Hi, this is Dana from marketing. Today we're going to take a little field trip down to Ready Care and get a drive-through COVID test. Okay, so now I've called the number 815-564-1999 and I've let the receptionist know that I'm here. I'm going to go ahead and pull forward into the tent. So Virginia's there. She's motioning me to come forward. So as you can see in the tent, they're very busy. They have lots of patients coming in and out.
Hi.
Hello, I'm here for my COVID test today.
Can I have you verify your name and your date of birth, please?
Julia Land, 5/23/1982.
Thank you. I'm going to get some vitals from you.
All right. She's gotten my temperature. Taking my oxygen level.
Yeah.
Can you tell me about the gear that you're wearing?
Sure. So we have, stay here for a minute. We have two different kinds of gear. So N95 mask is what Mandy is wearing.
Yeah.
This is a face shield, gloves, and gown.
Okay.
4 parts of our PPE that are crucial.
Okay.
Can't work without it. A little bit more high tech are these pappers, and they have air blown into it inside, so it's kind of refreshing, so we can take a deep breath but not wear masks. We have a seal here so that our face is covered. We have gloves and a gown too. So
Okay.
again, it's all the same type of PPE that we absolutely need to be able to work out here.
Okay. Can you explain to me what you're going to do next now?
The next thing that we're going to do, we are going to swab your nose with, I don't know if you can see it or not, this is a nasal swab, nasopharyngeal swab that goes into the nose, each nostril, both sides. As you can see, there's a little felt tip up there, and we gently go in each nostril, each side, and then once that happens, then we put it into this vial. We open it up and then we break it and we put it in there, and then we label it, we put it in here, and then she takes it inside.
And then just turn towards me a little bit, and we're going to go up to one side and the other.
Easy.
So, I'm going to break the swab into the jar, and then I'll put the lid on and take it inside.
All right.
Now what I do is I get a release of information here so that when you call in, we'll already have that and your work can have your information.
Okay.
The next thing that we do is that we give you information from the CDC on what to do when you're sick and COVID-19 instructions. And then the last thing is we would examine the patient in the vehicle. It's a limited exam secondary to the COVID-19 precautions.
Okay.
But we can look in their throat with our pen light. With our stethoscope, we listen to lungs and the heart. If there's anything more in specific, like with kids, we would look in their ears. But otherwise, what we say is that it's a 2 to 4 day turnaround time. As long as it comes back negative, we give you paperwork to go back to work and school. But unfortunately, we assume because we're swabbing you, you're positive. So we ask that everybody in your home come home and stay home until the results come back. And again, as long as you're negative, you go back to your life. But if you're positive, unfortunately, the health department will reach out to you. They're going to want to know who you've been around for 48 hours prior to your symptoms starting. They're just going to reach out to them very vaguely, say you may have been exposed, that if you're having symptoms, you should probably be tested. If you're not having symptoms, you should stay home, wear masks, and they'll give you more directions at that point.
Okay.
So, any questions?
No,
All
I don't
right.
think so.
Thank you.
Thank you very much. And I am finished here. Okay, now here we are inside, and we are going to get the point of view from the receptionist and what happens beginning when a patient calls in. So I'm entering the reception area. This is Michelle. She's going to tell us about what happens when a patient calls in and needs a COVID test.
All right, so they call in and they tell us that they'd like to be tested, or they're having symptoms, or they've been exposed. We just verify their information, birthday, home address, insurance information. And basically, that's all we do on the front end. We're going to put them back to the nurse's station, and they're going to follow up with questions of what their symptoms are, how long ago they were exposed, and things of that nature. When they call back here, once they come for the test, then we would verify again that they're parked in the correct place. We would tell them the process of waiting where they're parked, and that someone would be out and tell them to proceed under the tent for the testing.
Okay.
Yeah.
How many phone calls a day are you taking on this?
250 to 300 phone calls a day.
Okay.
Yeah.
Hi, my name is Arisha and I'm a nurse here at Ready Care. What I'm going to explain to you is the COVID process, well, the triage COVID process. So once we receive the phone call from receptionist, we get the phone call back here. We have a paper here that we have to ask a couple of questions. Just the patient's name, symptom onset, we get their birthday, the car make, color, and model. And we use that. That's a big thing. So when the providers go out, they can easily identify the patient in their vehicle and direct them to pull around underneath the tent. And once we do that, we turn this paper in to receptionist, which they then print out stickers, the route sheet. We attach all this together. It's taken to the provider, and the provider and the provider's assistant will go out with the car make, model and direct them underneath the tent.
How many tests do you think you're doing a day?
Oh, well, we've been at least at 100 every day for, I say, a week or so. Monday was our big day. Of course, we hit 146, but we usually get right at 100.
This is the COVID room. This is Amanda. So this is Cass. This is where all the registration comes in. This is where we chart. And then the provider, the assistants to the providers have the other two rooms. We try to keep at least 6 feet from everybody. We absolutely have the masks on at all times. In case there were, somebody here with a positive, that way we can always be on guard. The biggest thing is trying to take the gear off to drink and eat and go to the bathroom. So it is a little bit of a process. I actually am going to show you right now. These are clean. We use hand sanitizer. I'm going to grab my mask. Put my mask on. Take my helmet off. Because we have so many cars that come through, we need 2 providers at all times. Saturday and Sunday is a little bit hairy because we only have 2 providers out there. Some Saturdays and Sundays are not busy at all, but other Saturdays and Sundays, especially this last one, we've had 50 patients in 4 hours, so it's a lot.